Welcome to The Point, a podcast by Apex Benefits and dedicated to employee benefits thought leadership. You can find more episodes for free on iTunes by searching The Point or Apex Benefits. Please rate, review, and subscribe to be the first to know about what we have in store for you. To learn more about Apex Benefits, please visit our website at www.apexbg.com or find us on LinkedIn, Facebook, or Twitter. Let's get to the point together.
Welcome to The Point. This is Scott Long with Apex Benefits, and on today's episode, I am sitting down on screen and on phone anyway because we are socially distancing with a colleague of mine, Erin Albert. Welcome, Erin.
Thanks, Scott. It's good to be here.
Absolutely. Hey, before we dive into this topic on opioid abuse and resources, could you just share a little bit about yourself and background?
Yeah, absolutely. So you and I, as you alluded to, are colleagues now. I joined Apex Benefits back in April, although it feels a lot longer than that right now. I think our sense of time with COVID-19 has been somewhat altered, but I am a pharmacist. I am the first pharmacist that Apex Benefits has hired, and I work on the population health and analytics team over at Team Apex. And what we do is we help our clients save money and then tighten up their clinical programs around their pharmacy benefits. And as you know, Scott, right now, pharmacy benefits are starting to consume a larger percentage of the total healthcare benefit pie.
No kidding.
So yeah, we're looking ahead to things like gene therapies, orphan drugs, specialty medications, because these therapies can cost just one patient with one dose millions of dollars potentially.
Absolutely.
So it's my job to go in and try to find opportunities for savings, whether it's looking at the pharmacy benefit manager and what services they provide to our clients, particularly in the self-funded realm, to try to save money, to streamline clinical outcomes. There are lots of drugs out on the market, and not every drug that is approved by FDA necessarily needs to be on a drug formulary. So we really do a good job of trying to balance clinical with financial in terms of outcomes and optimizing therapy for patients.
Absolutely. Yeah, looking at site of care, purchasing, bringing prudence to the conversation too. So, hey, I appreciate you spending time and kind of carving out time, as we talked about. Opioid abuse and really the opioid crisis is obviously a tough topic. It's not the most cheery of topics, but at the same time, it's something that we know that we're taking a industry leadership role here in Indiana. Last year we devoted an entire event within our Employers Survival Guide series to the topic, and had just about 100 people in the room listening and interacting with our staff and our guests. And I wanted to make sure that we did an update of some type in 2020. And when you came on, it's like, let's get this scheduled and dive in. So with that in mind, what's the status of opioid overdose data from 2019? In the country, so U.S. and then relative to Indiana.
Yeah, it is a tough topic, and it's one we definitely never should take our eyes off of. I posted recently about the fact that this is really the other pandemic. This was the pandemic that was, ravaging our country prior to COVID-19. So I appreciate that, you're bringing this topic back up this year, and that Apex had a summit on this last year. But relative to the data in 2019, we had a record year for opioid overdose. We had over 70,000 projected overdose deaths in 2019 relative to opioids. And that really topped the previous record of just over 70,000 as well in 2017. So we had a little bit of a dip in 2018, but we're unfortunately back up. And the experts are really saying that, it could be even worse in 2020 due to the fact that, we're still underway with this other pandemic. 35 states actually saw overdose death increases, and then 13 in 2019 recorded declines.
Yeah, that's lopsided, right? And it's not where you want to be.
Right. And the shift over the several years now has been from overdose due to prescription opioids over to synthetic opioids. So these are illicit opioids, things like fentanyl, heroin, that are, freely or relatively cheaply available and really not involved anywhere near the pharmacy. So prescription opioid dispensing has really dropped since the CDC issued opioid prescribing guidelines back in 2016.
Mm-hmm.
But that was good in that, it resulted in less prescribing of opioids, but that in turn kind of drove a lot of the addiction over to the synthetic and or illicit opioids. So here in Indiana, we also have daunting statistics, and just most recently at the end of May, the head of the State Family and Social Services Administration, Jennifer Sullivan, announced that Naloxone, which is the temporary, treatment to reverse opioid overdose, was used more in April of this year, 2020, than any other month in the state's history. And that was over 1,300 times.
Wow.
So this is really a 35% statewide increase in the use of Naloxone over 2019.
Wow.
And there's lots of factors here. I think COVID-19 has really accelerated a lot of major issues.
Mm-hmm.
One being opioid addiction, because people are socially isolated. There's economic hardship. People are losing their jobs. And that leads to the perfect storm, if you will, for potential for more self-medication and or addiction problems.
Yeah. I can't argue that point. I'm thinking about on a regular day, pharmacists, you all are, you're on the front lines of healthcare, period, right? And then you'll layer in this opioid crisis, and then this year you layer in on top of that, COVID-19. Aaron, share with our listeners, what's been done in just the recent past, and then what can pharmacists do to stop or prevent opioid overdoses and addiction?
Yeah, great question, Scott. And first and foremost, shout out to my brothers and sisters on the front lines in pharmacy, especially during the pandemic. I know there's been a lot of movement around provider status for pharmacists, and they've certainly earned it by stepping up and doing COVID-19 testing and never stopping their jobs during the lockdowns where we all had the privilege of, locking down. So shout out to them.
Right.
But the pharmacists, patients, legislators kind of all need to work together to, suppress opioid addiction. So it's not just on the pharmacist, I think. But the Indiana General Assembly has really done a good job, I think, over the past several years in limiting opioid access, at least on the prescription side.
Yeah.
And opioids for dispensing and prescribing have been reduced to, for the most part, a 7-day supply. So, for example, when you go to your dentist and you have a tooth pulled, he or she may write you a 7-day supply of that drug. But that's to say as well that the Indiana General Assembly has also put into place a law where you can request, when you go to that pharmacy, less than 7 days supply on that prescription opioid. If you only need like a day or two, just go ahead and request that right when you're filling the prescription. That way you don't have opioids sitting around your house unused, because that's really a liability.
Yep.
So don't be afraid to get less if you need less. Pharmacists and healthcare providers also have access to a system called a prescription drug monitoring program, or PDMP. Here in Indiana, that program or system is called Inspect. And what they do through that system is just check to make sure that patients aren't showing doctor shopping, meaning that they're going to doctor to get opioid prescriptions. And what's great about the PDMP now is it interconnects with other states as well. So you can see if you work as a pharmacist, maybe in Terre Haute or South Bend, where you're on a border, whether or not those patients are crossing state lines to get opioid prescriptions.
Interesting.
Yeah, and now in 2020, there's an initiative based upon most recent Indiana General Assembly to have all controlled substance prescriptions, including opioids, only available through electronic prescribing by the end of this calendar year. So I know pharmacies right now are working hand in hand with the state to make sure that they are integrating with the electronic health record systems of major hospitals and healthcare systems across the state to make sure that we have connectivity, interoperability when it comes to e-prescribing of controlled substances by the end of the year. And then last but not least, I think it's really important for patients themselves to understand, if you go to any of your prescription vials, you'll see this teeny tiny font. It's like 4 or 5 point font on every prescription label. And that little saying is, caution, federal law prohibits transfer of this drug to any person other than the person for whom or from whom it was prescribed. And that means that you should never share your prescription drugs, particularly opioids, particularly any pain medication. It is never advisable to share medications. So that little reminder is on there that, you know, you shouldn't be sharing opioids. That's why it's really important to only get what you need and don't have it lying around the house.
Yeah, good risk mitigation, and for most of us that seems like an obvious caution, but putting it in black and white is going to have an impact, no doubt. So in general, so what about the drug that you've mentioned, the opioid overdose reversal drug, Naloxone, right? So we were joking offline. Sometimes the pronunciation is a little tricky, but I think I got it. I think I nailed it, Aaron. What about that drug? What's the latest? What's happening in and around access to the reversal drug?
Yeah, naloxone is an interesting drug. It's been around for a long time. It is available for opioid overdose, both in a nasal spray and an injection. It's really important to note, however, that it's not a cure by any means for any type of opioid overdose. What it does is it reverses pretty quickly the respiratory depression that occurs in opioid overdose. Basically, people stop breathing. And so this is a rescue medication for people that are undergoing opioid overdose in the immediate sense. But as soon as you give this drug, you have to get the patient to a healthcare provider as quickly as possible, because the effects of it wear off very quickly. So just to put that out there, but there's no need, by the way, in Indiana for a prescription for naloxone. And a lot of research out there shows that naloxone is typically given by a family member and or someone else who might be an addict of opioids to one another. So it's important to understand that if you are a loved one of someone that is suffering from an opioid addiction problem and you're concerned about opioid overdose, it might be wise to have a naloxone kit on hand just in case. Now, certainly we're not promoting that, people overdose, but I think it's really important if you've got a family member that is in crisis, especially if you're in a rural community and don't have access to providers immediately, that you have naloxone on hand. And we're going to share a ton of links and resources in this podcast today and show notes. I'm going to try to write a blog for Apex around this as well. But there is a nonprofit along with the state of Indiana called Overdose Lifeline, and they've provided a website where you can request access to naloxone.
Oh, really?
And yeah, it's super helpful. I think we'll provide that link. You can also go into the state of Indiana's website, and they offer a tracker by zip code where you can find naloxone. So you can either go up to the pharmacy and just pay cash for it because the state has a standing order, meaning that no one needs a prescription to get naloxone access. But then if you're also struggling to pay for it as a family member or as an addict, there are resources available to possibly obtain a kit just to have it on hand at very low or no cost.
Yeah, I think that's really important because, let's face it, a good amount of our population in Indiana are in rural environments, and being able to locate, a kit is critical. So, yeah, and again, just to reiterate, we will have a lot of these links, the links that we're talking about within the episode description, and Aaron, that'd be awesome if you did did a blog. So, hey, let's talk about the intersection of opioid addiction and COVID-19. So, what's been done? What's the latest with treatment of opioid addiction, just in light of course, COVID-19?
Yeah, that's really a tough challenge right now, Scott, because of social distancing, because of the fact that a lot of healthcare centers had to kind of shut down during COVID-19. So that's a great question. What they use for opioid addiction treatment is what they call kind of generically medication-assisted treatment, or MAT. And there are three major drugs that are in that category of MAT. One is methadone, another buprenorphine, and then the third is naltrexone. But it's really important to note that in addition to using those treatments, it's required to have counseling and cognitive behavioral therapy on top of that. So I think the cognitive behavioral therapy part has been the biggest challenge during COVID-19. And we've had, at Apex, lots of blog posts about the fact that mental health issues are really skyrocketing as well during COVID-19. So I think it's been really critical to try to make sure that our addicted population has access to the CBT and to counseling at this time, and that's been one of the biggest challenges. But the state of Indiana and FSSA, as I mentioned before, who puts out the opioid statistics, they actually have a list of approved opioid treatment programs, and we'll give you that link here in our show notes and the blog as well. Buprenorphine also is federally looked at by providers, and you have a list of providers at the federal level at a site called SAMHSA, and we'll give you that website as well. And then naltrexone actually can be prescribed by any healthcare provider, but an individual must abstain from opioid use for 7 to 10 days before starting that one. So again, it's mission critical to have that cognitive behavioral therapy in addition to counseling on top of these therapies. These are not drugs that you just take and you're miraculously cured of addiction. It is a long haul, both on the CBT side as well as the medication side.
Yeah, no, I appreciate that. So hey, let's switch gears. Let's talk about prevention. Okay, so you mentioned a few minutes ago that one of the options, if you are in a position where you're filling a prescription, you can get a reduced prescription, less than a 7-day. You mentioned only taking what you need. Don't leave opioids laying around the house and so forth. What should people do if they have a prescription and the opioids have gone unused? They are actually in their house. What can people do?
Yeah, that's a great question, and one that's kind of evolved over time. I know I used to watch the Indiana Board of Pharmacy monthly meetings when I was at Butler University for the college, and there's been a lot of technology that they've integrated and a lot of programming to get those drugs out of people's homes and mitigate that liability. So I think the first step there is talking to your pharmacist. See if he or she has a drug take-back program for opioids and or unwanted prescription drugs overall.
Yeah.
Now, you can't, in the state of Indiana, return drugs to the pharmacy for any type of refund or reuse, obviously, for safety reasons. But many pharmacies will take back those out-of-date or old or unused prescription drugs and safely destroy them for you through safety programs that they have in place. But just call your pharmacist and ask if they have any of those programs before you take those drugs back. Also, the Drug Enforcement Administration, who at the federal level oversees what's called the Controlled Substances Act and kind of sets the law on a federal level for controlled substances, of which opioids are included in that, offer usually a prescription drug take-back day. And that's once or twice a year in the spring and the fall. And in preparation for our chat today, I did look it up. The next DEA drug take-back day is going to be October 24th. Okay. So if you have a hard time remembering that, just think about it around Halloween.
Yep.
And what you can do is go to DEA's website. We'll give you the link. And by zip code, you can actually find usually pharmacies that have sites where you can drop off those drugs and destroy them or have them destroyed. So again, it's, I think, really important not to have opioids sitting around your house. I mean, I've heard of horror stories where people are trying to sell their homes and there will be addicts who go through house visits and things like that just to look for unused prescription opioids. So if you have them lying around, be sure to lock them up, keep them away from the kids, and then around Halloween time, take them to your pharmacy and get rid of them.
Yeah, that's right around the corner. That's super helpful. It's helpful for a couple of reasons. I know many of our listeners, have unfortunately have family members. Sometimes not immediate family members. Sometimes you might be helping an aunt or a niece or an extended family member. So the more that we can get these resources out to the community, I think the better. And of course, we're playing our part in helping mitigate risk, but also have a long-term positive impact. So let's, as we wrap up, let's talk about, a little bit more about how people can get help. So, if you've got family members that are suffering from addiction, or even, one of these events, an overdose, in Indiana, where can you get help?
Yeah, that's a great question. So beyond the obvious 911, if you're in an acute situation, obviously that's the first place you want to dial if you've got an immediate need for opioid overdose. You could dial 211 now in the state, and it's a free and confidential service that aligns people with the resources they need. And I don't think it's confined per se to drugs. So, I know there are a lot of, Hoosiers out there that are really suffering right now. And so dialing 211 can sometimes get you some resources that maybe you aren't aware of. The state health department provides training and kits to local health departments. Okay. So check with your city or county to see if they have naloxone kits that are available. There's lots of kind of partnerships between the state and nonprofits. Opt-in is a program in the state that provides a list of entities that are naloxone providers as well. Okay. We'll, again, have all of these links and show notes for you. I know for providers, healthcare providers, they've been having an annual conference on substance abuse called Bitter Pill. That's a great resource for other healthcare providers that might be listening here. And then last but not least, the Indiana Recovery Alliance. They also distribute naloxone and through community training, because you do need a little bit of training in order to administer naloxone, especially if you have an acute situation. So lots of counties have these resources. I would check. And to your point earlier, Scott, a lot of this happens much more frequently in those rural areas. So I think it's even more important in particularly rural counties. I know Clark County has really been struggling with opioid overdose in 2020. If you're a family member, be proactive and try to get access to these naloxone resources before you need them.
Yeah, absolutely. I mean, I think it's just important to talk about, our state. We have many folks that are in a rural environment, and frankly, my teammates, your teammates that are involved with the public sector. The work that we do with cities, towns, and counties take us all over the state of Indiana. So I think I want to make sure that we drove that home, that there are resources and certainly the ability to search by zip is going to help meet that need. So, Aaron, thanks so much for carving out some time, to devote to this topic. Again, it's kind of with a heavy heart, but I think, from our vantage point, I feel like we've got to step up and continue to talk about it and take a leadership role in the conversation. Because it's well beyond just plan cost. What type of resources can we put in? The HR teams that we support, and frankly, their employees and family members. So I appreciate you carving out some time.
Yeah, and as a native Hoosier myself, I really want to see Indiana succeed and move forward in a positive direction. So it was a pleasure to serve you in this capacity, Scott, and as always, to serve our clients.
Absolutely. Aaron, have a great day.
You too.
You can find more episodes for free on iTunes by searching The Point or Apex Benefits. Please rate, review, and subscribe to be the first to know about what we have in store for you. To learn more about Apex Benefits, please visit our website at www.apexbg.com or find us on LinkedIn, Facebook, or Twitter. Let's get to the point together.